If you've ever found yourself, flat on your back, staring into the bright lights as the masked, gowned, and surgical team is swirling around you and telling you reassuring things just before you go to sleep, chances are there are surgical technologists in the room. These key players in the surgical environment provide the critical support for the surgeon and for the anesthesia team. Here to tell us more about these MVPs in the surgical environment is the senior department chair of one of our most popular programs for surgical technology, South College's own Chris Blevins. Hi, Chris.
Hey, thank you for having me. This is so fun.
Yeah, so I'm excited you're here. I've been looking forward to this. Okay, so the first question to start us off is explain to our audience what surgical technology is.
I would love to. I think that it is not a very well-known profession, simply because our clientele are drugged. So we don't get to typically see our patients prior to them coming into the operating room. And so it's a career field within the allied health world. And, most people assume we're either A, a surgeon, or B, a nurse, and we're neither. But the reason that they don't understand who we are in the operating room, and we're a necessary part of the sterile team that is operating on the patient. We're actually required to be in the OR as a part of the team in order for a surgery to even happen. But you're drugged. You're given medication in pre-op, and prior to that, you're visited by your nurse, you're visited by your anesthesia, because you have to sign certain consent forms in order for us to do what we need to do to you in the OR. But once you've been given that medication, you don't remember anything that comes after it. And you may have, glimpses of things that have happened, kind of like snapshots, if you will, that go off. But you don't typically remember us, because by the time you get to us in the operating room, first of all, we look like ninjas, right? We're masked. We have this scrub caps on. We're completely gowned and gloved. All you see are our eyes. But once you've been put to sleep by the anesthesia team, that's when our job begins. And the reason we didn't visit you prior to you coming into the operating room is because our job is to prepare the OR for the procedure that's going to occur. So all the instrumentation, all of the supplies, everything that has to be perfectly sterile and ready for the surgeon in order to be able to perform the operation, we need to make sure that that's ready to go.